Good day. This evening, my name is Mary Volkerding. I'm Community Relations Representative for a company called the Kentucky Health Cooperative. And don't worry if you've never heard of us, nobody has, because we're brand new. But at any rate, I started working for this company back in March, and it's been a very interesting experience because when I started in March and I started making phone calls across the state, because we are statewide, and we have all of two representatives to cover a state. Yeah, 4 million people, 2 people, that's it. But at any rate, that started finding out people don't know what's going on. And a lot of people still don't know what's going on. But I do want to let you know this, that all these disasters and nightmares you're hearing on the news about the federal program, and it's just terrible, and President Obama's mad, and everybody's calling for everybody's head, and it's horrible. That's not what's going on here in our state. We don't have a federal-run exchange. We have a state-run exchange. Everything's going very well. As a matter of fact, there are thousands and thousands of people that have already gotten signed up through Connect. So people that didn't have insurance coverage, that were probably going through the high-risk pool, who knows? But we don't know the metrics quite yet. They haven't quite released the actual numbers, and we'll find that out. But it's interesting to say that, you know, if people had kind of opted in for that state-run exchange, maybe things would have been smoother. Who knows? But don't believe everything you hear. Kentucky's doing pretty good. They really
Kentucky's ranked in the top 3.
That's right. That's
right. I mean, you hear about it on national news.
That's right.
Steve Bashir was on NBC yesterday.
Meet the Press.
The Sundays Meet the Press.
Yeah.
Because we're such a model.
It's so unusual for Kentucky.
Yeah.
Exactly. How about that? We're leading in something. It's amazing because some of the things we don't lead in. And of course we've got this beautiful state with all kinds of great stuff going on. And you know, it's so funny, every time I go out of state, somebody says, and they come out from Kentucky and they always go, "Do you have a horse?" No, I don't have a horse.
It could be worse.
But you're from Kentucky. You're supposed to have a horse. Yeah, they could ask that. I think hopefully they've evolved past that. But the horse thing, it gets me every time. But I guess I think we're just having a great time here, right? Because we've got fried chicken and championship basketball teams and horses. So there you go. But when we look behind the pretty picture, we see some things that aren't so great. Like we're ranking 44th in health status. And another poll has us 49th in that place. So we're not doing well in health. We've got some incredible bad health statistics here. Highest smoking rate in the U.S., 1 million plus obese adults. State with the highest rate of preventable hospitalizations. And as we speak here, I can still say that they're uninsured because their insurance won't take effect until January 1, those of you that have signed up already. Over 640,000 Kentuckians without any health insurance. And you and I both know why, because it's expensive. It's out of their reach. Even with the 2014 Medicaid expansion coming, because our governor ordered that as well, that was a facet available through the Affordable Care Act. For 3 years, federal dollars coming into the state to expand the Medicaid base, and he opted in for that as well, which is rather funny because a lot of the other governors that said, "Oh no, we're not taking that," a couple of them are bending and they're realizing, yeah, I think we could use that. You know, people need this. So anyway, so we are getting help in that way as well. But even when that takes effect, we're going to have about 308,000 people that still aren't insured. So what's to be done? Well, we know that back in 2010, after a lot of fighting and pushing and shoving and yelling and screaming, this act called the Patient Protection and Affordable Care Act was finally passed into legislation, probably the most sweeping health reform that we've seen since Medicare passed back in the mid-60s. And that program just celebrated its 45th anniversary, in case you wanted a takeaway for tonight. There you go. But anyway, so whatever you want to call it, and if you don't like it, you don't like it, and if you do like it, you like it, but it does head up to change, and it is our law, and we're moving forward with it. So that's the impression I just want people to know, is this all isn't an option. It's not a bad dream. It is the law, and it's been upheld. So we're going to go forward with it. There's actually a lot of good things that have happened so far from that consumer side of the Affordable Care Act. Can you all think of anything else in your lives already that you're experiencing because of the Affordable Care Act?
Well, I have a daughter that just graduated, and she's able to stay on her insurance
exactly
until she turns 26.
I have one like that at home too. Yeah. So I keep telling her she's got 2 years to find an employer that has insurance, or she's going to be paying money. Yeah, we'll see.
I've got one. My husband and I both are part-time faculty at EKU, and we cannot get insurance through our job because we're part-time faculty. And in January, we will qualify for health insurance
Through the Connect.
through Connect.
Cool. All right. Anybody else?
I'm in the same boat as Patty. I have a 21-year-old who's not in school, so she's still on.
Yeah, that's
Yeah,
true.
that-
My
that-
son with autism also is able to stay.
Yeah, that typical gap that a lot of young people can face between school and getting out and getting a job or whatever, so they can have insurance with no worries. Anybody here considered, or anybody in your family considered uninsurable? You know, like an insurance company has denied someone
It doesn't
coverage.
take much.
That can't happen anymore. That's against the law.
That actually happened to me over the summer. I decided to look into private insurance, and when I did, they were going to cover both my husband and my son, but not me, based on weight. That was it. That was their only reason, was because of my weight. And they were only going to cover my son's therapies for 6 months.
Wow.
I can't believe they would not insure you because of
Well, they're good.
That's what they said.
The insurance companies have always been able to get around conditions that they consider, expensive to cover. So that's going to be against the law now. Pre-existing conditions, people don't have to worry about that. So that high-risk pool that I mentioned a few minutes ago, that's sunsetting. That's going to be, January 1. There's no existence for it anymore. People that have not been able to get coverage can get coverage now. An insurance company cannot deny someone. Insurance companies can't come to someone who's used a lot of insurance, like through hospitalizations and whatnot, and say, oh yeah, guess what, you've run out of insurance now. You've topped out your policy. That's no longer allowed. So there's a lot of good consumer side of this law for us that is going to be a good thing if you haven't already experienced it. I didn't even do that already. Something else that happened through all the compromising was the creation of what they call the health cooperatives, and that's where I work, at a health cooperative, because back in the original intention of this act, when it was first being brought out and introduced, the original idea was to give everyone who didn't have health insurance a public option, meaning they were going to give them access to the federal Blue Cross and Blue Shield coverage plans that the federal government employees and members of Congress are covered by, otherwise known as the Cadillac of insurance, right? So that was the original plan, and that didn't fly. They had to go back to the drawing board through all that compromising. This act is nothing but compromise. I mean, it really is. I don't know if you followed it. After a while, I think we were following it and zoned out on it. But it's been nothing but compromise, the passage of it, and that was part of it too. Went back to the drawing board, said we want to have something to bring in some other coverage options that might be a little bit different in its scope, but it won't be that Blue Cross plan. So they came up with forming health cooperatives. And Kentucky is one of 24 states that has the health cooperative. Loan money was available through the Affordable Care Act to get these health cooperatives up and started. It's not cheap to stand up a company and get that going. So 24 states, including Kentucky, were able to make the grade and get this loan money to get a health cooperative started here. And this is some of the things that it was kind of charged with, all the states that have them. And it runs just like a co-op. If you've ever been a member of a co-op, you're probably familiar with that business model. Voluntary open membership, member governed. That means people that buy into the co-op, so people that are going to be buying insurance from the Kentucky Health Cooperative will become members. They will have a voice and a vote. And whatever money may be made in revenue as an overage as the years go by goes right back into the co-op because there are no shareholders. Nobody's trying to make money on people's being covered by health insurance with this. It goes right back into the co-op to either enrich benefits or to keep premiums at cost or lower premiums. That would be the ideal world. But anyway, so that's where we're coming from with the idea of a health cooperative. Can you imagine? Basically a non-profit health insurance company. When's the last time you heard about that? So that's what's new, and like I said, we're one of 24 states across the country that have gotten this money to have a health cooperative. And we started selling our plans with the other commercial insurers on the exchange on October 1 on Connect, and that's what we've been doing business just like that. Another reason that is a good thing about, I'm going to come back to that in a minute, about the co-op way of doing insurance there is we must be offering widespread coverage, because at this point in time, insurance kind of works on what they call rating regions, where an insurance company can decide to offer coverage in a particular area or not. And I don't know if you've ever been around Eastern Kentucky and talking about people there, but they don't have a lot of insurance options there, because a lot of insurance companies have said, no, we're not going to do business down there. Yeah, that's not worth it, or this is not right, or that's not coming out right for us. So our co-op will be doing business in all 120 counties. So that was one of the charges, giving everyone a widespread coverage option. Affordability, and it seems to be panning out on the exchange just in that way, giving people access to coverage that's going to help them. So if you want some light reading before you go to bed tonight, you can look this up, because that's where we are in Section 1322 of the Affordable Care Act, Consumer Operated Oriented Plan. That's where we're all laid out there. We are a fully regulated health insurance company, just like any of the other guys doing business here. That Department of Insurance, they rule our lives, just like they do all the other insurance companies. We're not federal or state. We're not to be confused with the Health Benefit Exchange. People love to confuse us with that, because the first two words are the same, Kentucky Health, but we're not. We are a carrier that's offering plans on the exchange. So that's where that stops. We've got a board right now that's it's a formation board, but as I said, through the co-op model of business, we will have our members elect the board as the years go on and we become operational and working in that way. So there again, there's our charge. Meet widespread needs, therefore statewide, all 120 counties, access to affordable coverage, high quality care at lower cost. So where is all this available? This is where people can go now to shop for their insurance. I mean, this is kind of unprecedented. Basically, what you're doing is having a one-stop shopping experience for insurance, instead of having to make multiple phone calls and talk to multiple people and then, get all your papers out and look at them across the table. It's all on a website, and that's all the Exchanges Connect is, a website. It is a way for people to go and look at insurance options if you don't have any. Now, if you already have insurance through your employer, great, you're good. You don't have to change. If you're already on Medicare, you're not going to have to go to the exchange. If you're already Medicaid eligible, you should remain eligible as long as all your parameters are still in place. But if you don't have health insurance, or someone in your family is not covered for one reason or another, this is the place to go to shop for it. There are two good reasons to go to the exchange or Connect. They branded themselves Connect. All the exchanges in the states that have them, they went through a branding and a marketing process, and you've seen all the ads, I'm sure, in the commercials for this. They just want people to know about it, become aware, and go there. Because in my mind, my true takeaway for you all tonight is that all roads will lead to the exchange. If you don't have health insurance, this is really where would be a great starting place for people to go to. Two good reasons. One, the big variety of plans. We're talking total exposure for insurance companies now. All the plans laid out side by side with the premiums and what they cover in their networks. It's all right there so people can see. The other good reason to go is because a lot of people are going to qualify for premium assistance. Subsidies. They call it the Advanced Premium Tax Credit. That's the technical name. I'll explain why they call it that. But I'm going to show you a little bit better everyday dollar slide next. But I just wanted you to look at this. This is a profile of the population that will be eligible for some sort of subsidy, getting help paying for their insurance. Okay? That big white swath going down there in the middle, that's going to represent 139% up to 400% of federal poverty level. Those incomes will be eligible for some sort of assistance paying for insurance. Because, the middle name of this act is affordable. So that's what's going to help there. And when we're talking 400% of federal poverty level, that's a family of four making a little over $96,000 a year. So even, the higher income families are still going to get a little bit of help. The ones that don't make as much, at 139%, they're going to get more help. It's a sliding scale, which makes sense. Up there in the top upper right-hand corner, those are the folks that right now, they're already eligible for Medicaid. That shouldn't be changing for them. And then that gray area between the two, that's the expansion coming in. So that will take up to 139% of federal poverty level. Okay? So that's how it works. When we get to the exchange, we find that all the insurance companies, this is pretty much true across the country, according to the law, that they've all arranged their policies in what they call metal tiers, metal coverage levels, starting with platinum, gold, silver, bronze. There's even catastrophic level coverage available for those that are under 30. Because for some reason, people under 30 that don't have insurance don't think they need it. But anyway, it is there. It's very low cost, but of course it's got a lot of high out-of-pocket to go along with it. But anyway, so you've got your metal levels there that are available for people to decide what they want, what they need, what they can afford. Nobody is saying, one size fits all. We know that that's not the case here. Nobody's saying you're going to have government insurance. You're going to pick an insurance company that you want. Even if you're a Medicaid patient or a Medicaid user, you get to pick the Medicaid company that you want to have. So everybody's got a lot of choice, and believe me, free market is still a big part of the Affordable Care Act. I mean, this is not anything that anybody's taking business away from anyone or anything like that. It's just a way for people to purchase insurance differently and to be able to afford it if they need the help. So here's a little bit better table here, as I said, in everyday dollars. And this is based on a family of 4. This is a family of 4 looking at mid-level silver coverage and different income levels. I wanted to highlight that 200% because we're projecting to see a lot of Kentucky families fall right in there. And that's a family of 4 making slightly over $46,000 a year. So in today's market, if they went out shopping for insurance, and we're assuming this family doesn't have group insurance through an employer, they went out shopping and they're saying, gee, if we get coverage, it's going to cost us $12,000 a year, $1,000 a month. Trust me, that's not outrageous. That's not an exaggeration. I know people that maybe they own their own company. They've been paying this kind of money for years to have their own insurance, their private insurance for their family. So there's probably a reason why this family is uninsured, because that's a quarter of their income to be paying for insurance. Probably not feasible. And you'll notice too that even the family up there that's making over $92,000, well, they're still going to pay $1,000 a month too. Might be a little bit more affordable. But when these families go to the exchange and they can start shopping, they're going to see that because of their varying income levels, family size, they're going to be eligible for premium assistance. And it makes sense the way it's structured here on that sliding scale according to income. This family, for the 200% of federal poverty level, they're going to be in line to get $758 a month toward a $1,000 a month policy. That's for a family of 4. Yeah, that sounds like a lot. That's deep, but you know what? That's 5 people or 4 people being insured there. So that means instead of paying $1,000 a month, this family is going to be on the hook for $242 a month to have insurance for their whole family. But I'll talk to a lot of agencies and organizations who help low and moderate income families, and they say, well, that's all well and good, but they might have trouble even paying that. So then what are they going to do? Because, if when you and I go to the doctors, what is it, $35, $40 a copay? My insurance, I have to pay $50 to go to a specialist. That's, can you imagine a low-income family thinking twice about going to the doctor because they're thinking, I don't really have that extra money this week. What are we going to do? So what the exchange will do for those people up to 250% of federal poverty level is allow them to be in these 2 silver plans called cost sharing. That means those plans will have much lower out-of-pocket costs for them, like maybe a $5 copay, maybe minimal, if any, deductible that certain charges have to go toward. Because insurance is really still working the way it's always worked. There are out-of-pocket, cost-sharing, deductibles, all that kind of thing is still there, but just to varying degrees. So if someone were to purchase say a platinum plan off the exchange, they're going to pay more for that in premiums, but they're going to have less out-of-pocket. So they may very well have $10 copays, $15 copays, versus the probably who might buy bronze coverage, which is going to cost them a lot less than a premium every month, but when they go to the doctor, they might have a much higher copay and probably, a higher deductible. So you can see that it's gonna work like that, structured just like insurance is now. It's not very different in that regard. But these abilities for people to get help to pay is there now, and that can only be done through the exchange. So insurance agents are still part of our world, they still have their business, their role, and they can help you, but you can't, if you apply for your insurance through an insurance agent, they can't get you the advanced premium tax credit. And I was going to tell you why it's called that, because that means somebody can take the help then, right then when they're applying on the exchange, and that will end up being their monthly premium payment, or they can wait and take it all at the end of the year and get it back as a tax credit on their taxes. Because some people might think, well, you know, I have kind of a fluctuating income. Or I think I'm going to get a raise, or I'm going to get a better job, I'm going to make more, I sure don't want to get in trouble and then have to pay back money at the end of the year. You know, if that makes sense, it's kind of structured like a lot of tax things would be. So that's where we are with the advanced premium tax credit. Does that make sense to you all, why they call it that? That you can have the option of taking it then or taking it later off your taxes. And speaking of taxes, that is where everything will kind of filter out at the end of the year for all of us with our insurance. I've actually met two people in the past few months that were living in Massachusetts, and of course they have what they call Romney Care there, which is, that's what this is, if you didn't know. Same thing. But they said at the end of the year, on their taxes, and I'm sure we'll all have a new tax form, they're probably doing it right now, it said, how much did you pay for your health insurance this year? Or are you covered? Do you have group insurance? How much did you pay? If not, how much did you pay directly for it? And if you put 0, well, then the next line says, then add this penalty in. Because that brings me to the next topic, is the penalties. The individual mandates are still in effect. They haven't been delayed. The big mandate for the big companies has. If there's a company that has over 50 employees, they have been delayed for a year. They don't have to worry about not providing the health insurance just yet. But the individuals do. So all of us, you and I, have to be covered by insurance, or we will be facing a penalty. They're starting out small at first, $95 a year. They'll never be more than 1% of someone's income. So that's how it's going to be, and it's going to gradually grow a little bit for the next 3 years. It'll basically get to the point when the penalty would be as much for someone to get covered by a low-level bronze plan. So at that point in time, I think somebody would throw the towel and go, okay, I've got health insurance now.
Why would they delay the big corporations that are making all the money?
Why did they?
Stick us with the...
No, probably politics.
So,
You know.
we call it we call paid lobbyists, yes.
Yeah, well, yeah.
So, but I
Draw your
heard
own
that they're gonna
conclusions.
delay the mandate for individuals.
You heard that?
Yeah.
To me, honestly, that to me is a moving target for all of us. We don't know. And that, I think I'm glad you brought that up, because that's something we really have to keep in mind. I mean, think about it. This is a brand new thing. It's enormous. It's fluid. It will be changing. I think there has been talk of that, of a little bit like a 6-week delay, but nobody has gone forward and said it's going to happen. So we don't know.
The news today says the Obama administration is granting a 6-week extension until March 31 for Americans to sign up.
Okay.
So,
Okay.
nothing to post.
Nothing really new, because the exchanges are going to be open until March 31st anyway. So, you know, everyone had until March 31st to get covered. And the exchange will close March 31st. It won't open again until October 1. Unless you have an extenuating circumstance, life event, adding a baby, subtracting a spouse, you know, losing a job and needing your own, you know, that sort of thing.
So that's gonna be just kinda like how regular insurance.
Yes,
Yeah.
precisely.
Qualifying event.
Yeah, open enrollments, qualifying events, yeah, just like insurance works now.
So, but if we get into this and we decide, hey, this isn't for us, we don't like the coverage, can we switch back to our old coverage?
What do you mean old coverage?
Like if we were with, going through the rep like you were talking about.
You don't have group coverage?
No,
Oh,
like,
you pay
say
for it.
we were with, Anthem Blue Cross Blue Shield
Mhm.
on a family plan and switched to this,
Mm-hmm.
and we found that we didn't like it as much, could we switch back?
Well, what insurance, typically how it works, and this is Department of Insurance speak right here, is you got a 30-day process to back out and not have it. 30
Okay.
days, yeah, kind of a try it out.
And then after that, you have to wait until the open enrollment period.
Yeah,
probably.
then you would have it for the year until your next open enrollment, and then you could switch back.
Okay.
Yeah, but what you're gonna find on here is that Anthem is there.
Okay.
Anthem's got plans, Humana's got plans, Kentucky Health Cooperative, where I'm from, has plans. Those are all individual markets, and then United Healthcare is in the small group, we're in the small group. So all the people that you know about insurance, they're there. They're offering coverage. It's not, this isn't a special coverage. People, a lady the other day, she said, well, are you gonna be covered by Obamacare? And I said, when you say that sounds like President Obama is out there writing insurance policies out of the White House. That's not quite what it is. It's, yes, I'm gonna have insurance. It's gonna be through an insurance company. That's how it's working. And people, I think, are getting the impression that it's some kind of government insurance, and it's certainly not. It's just insurance company that are selling, and you can pick and choose which one that you want to be covered by. Yeah. But if this connects, there's just that purpose. It lets people make choices. It lets them determine if they're eligible for premium assistance. It also lets them determine if they're eligible for Medicaid. Because when people go there, they put their income level in, the exchange will know. It's like the all-knowing. It will say, oh, you're going to be Medicaid eligible. It will take you into the portal for the de facto Medicaid application. Yes.
Oh, I wanted to say something about the Medicaid options on there. I think there are 5 managed care organizations, and Anthem Blue Cross and Blue Shield is one of them.
Yes. Yes.
And there's also Well Care and Coventry Cares, and I can't remember
the
the.
Humana.
Yeah, I can't remember.
Organization.
There's Humana on there, and then there's one other one.
Yeah.
But can I ask about the Medicaid? Because my daughter has a medical card with disability. She's also covered by my private insurance as well as her father's private insurance. We've had a lot of health issues in the past, so we were covered. If she has the medical card, the Medicaid, and I still want to purchase her a insurance, because the way it's set up now, many doctor's offices won't take a medical card. Like the doctor I take her to does not.
Right.
So do I still have that option? Of course, she wouldn't get any assistance because she's got a medical card, but how does that play out? I can still buy her a premium, with you all, that's private?
I mean, as far as I know, you can. Unless there's something that's going to prohibit that in her special case, I don't know. But as far as I've learned and been told, it's possible. But like you're saying, the subsidies might not be there because she is Medicaid eligible and gets that.
But would this keep, like in your situation, would this keep kicking her back to Medicaid? And
It
not
might.
showing any plans that
It
she
might.
could do?
It might. It might not let you advance into that. You're going to have you been on there yet to
No.
see? Yeah, I would advise you to go on there. And you all can go on Connect and browse plans. You don't have to kind of like lock in and go to the point where you're actually enrolling and signing up. There's a browse feature. You can just kind of check everything
Okay, well,
out.
let me ask you this. Okay, she is a dependent on my policy right now, and I'm a retired state employee. Now, I turn 65 in April, so then I have to go on Medicare.
Right.
And she then will no longer be capable of being a dependent. I will no longer be covered under the state Humana. Is that considered a qualifying event that at that point I can then try to get her coverage?
It sounds like it. If her coverage is ceasing, yes. Yeah. You have a question? Go ahead.
I was gonna say, when I went on the Connect website and did everything, my son's already got a medical card, and what it did, it just said not qualified at this time for him, but his medical card still stays in effect. So, and he's straight Medicaid because we get it through Michelle P. Waiver.
Right, but I want something in addition to the medical card, because a lot of doctor's offices won't take a Medicaid card.
Right, something like, I have a friend who has juvenile diabetes. And when we worked together before, she had the health insurance through our employer, but she had a supplemental insurance policy, and I think she still carries it to this day for that very reason, because she has a health condition that could potentially be very expensive.
Yes.
And that's why she had the supplemental policy. So that's kind of, I hear what you're saying, and I wonder about that, for our children. Because like Amelia is 21, and so by this law, she'll be able to stay on our policy till she's 26. But, right, she also has a medical card, so I wondered about that too. It's just like after she's 26, too bad for her, she's.
You know, if I were you, if you have what you feel are extenuating circumstances that are a little bit different than just straight out of the norm, you know, hit the buttons and apply, I would seek counsel from them. From Connect, you can actually call, believe it or not, there's a call center. It's actually based here in Lexington. And the Xerox got the contract for that. I'm going to show you the number here in just a minute. It's actually on their website as well. I would call and ask. Speaking of help, besides the number, Connect also figured, you know, not everybody in the world is going to A, have a computer, or B, know how to use it and get on this website and feel comfortable enough navigating through it and getting to that point. So what they did is they put out in the communities here, navigators and connectors. And there's all kinds of agencies that have these. Back when this is all going out and they're asking for people to apply to be helpers and in-person application assisters, KIPTA in Metro Louisville, they got a big part of the grant, and as well as Community Action Kentucky, if you're familiar with that. So those two organizations, for sure, have a lot of help at their offices, and they can help people. And health departments, all kinds of organizations. Connect should be able to let you know where they are in your area. So you can actually go there face to face and say. You can also check with the DBS office with Medicaid. They should be able to advise you on special instances like that. I would definitely get counsel on that. I would never guess that I'd be qualified to let you know. So make sure you check it out. Yeah.
Maybe you don't know this, but my son is also on Medicaid waiver. And so, but he's also on his dad's insurance, so I think the way it works is his insurance pays first and then Medicaid will pick up the deductibles or whatever. But you said something like, even under the Medicaid option, there's different companies?
Yes.
Does that mean that we have to choose a company for him?
Yes. You should have already, you probably have one right now, maybe you just don't realize.
If he gets it through if he gets it through a waiver, then you don't have to do anything.
Okay.
They choose it for you.
Although I found that,
It's straight Medicaid, it stays the same.
They changed it, because when my son first got the waiver, he got the medical card, but we weren't informed of any information about my provider. But when his younger sister got the waiver this past year, they got the medical card, and then 3 days later, we got a big package from his Wellness Kentucky or
WellCare.
So it's a managed health.
Yeah, so
plan,
whatever it was a whole big package about how to use their services. So we never got that for my son, but we did it with my daughter. So
So hopefully somebody will let us know if we need to do anything.
Yeah, I think they would. I think that the Connect would be your source to find out. Call or go to one of the helpers in person and try to do that. All right, well, moving on. Also, part of the exchange or Connect, I wanted to let you know this in case you know any small business owners that are out there, because they've set aside a portion of the shop, of the exchange called the shop. Small Business Health Options Program. This is where small companies, when I say small, at this point in time, we're talking about 50 employees and under. They can go to the shop and see if they want to get health insurance for their employees. And right now, there's no mandate for the 50 and under. They've never been subject to a penalty for not providing health insurance to their employees. They don't have to, but if they want to, because it is kind of a nice employee perk, employees like that, they might be able to find some affordable coverage through the exchange starting October 1, which, in fact, I heard the governor the other day on the radio said that I think we're supposed to 300 small businesses have already signed up for coverage through the exchange. If a business is even smaller, if they have less than 25 full-time employees, they may qualify for a tax credit for giving their employees health insurance if they meet these parameters. And this excludes the owner of the company. Because if they kept the owner, who's typically making a lot more money, they'd probably kick them all out. But it excludes the owner. And these parameters, if the average annual wage is less than $50,000, the employer is paying at least 50% of the premium for each employee, then they're eligible, or they may be eligible for tax credits. And this has been in effect since 2010 at the rate of 35%. And next year it bumps up to a 50% tax credit. So that might be helpful for a lot of small business owners who've been thinking, I really want to do this, but it's so expensive, they might find that this is going to work for them. So just another option. All right, so we know that the exchange has already gone live. It will run, as I said, through March 31. That's the open enrollment period. They've extended it. Have a super enrollment period this first year to make sure everybody can get in and have time. But if someone wants their coverage to be effective January 1, because that is the effective date according to the law, they really need to make sure they're enrolled by December 15th. Because that is going to make them, you know, you have to go, just like insurance always works, you've got that 15-day processing period and that sort of thing. So you have to get in there by December 15th to have a January 1 effective date. That's important to know. And then, as I said, enrollment help is available throughout all of our Kentucky communities. If you check out Connect, put your county in your area, they'll let you know where you can go. So what we've been doing is getting out in the state, me and another woman, she's kind of taken the western half, and I said, I'll take this half, and we've just been traveling a lot. We never see each other anymore, you know. But we're doing outreach and education. We're not selling insurance. I don't have an insurance license. I can't sit down with anyone and make quotes and advise anyone. I don't want to do that. That's not my role at all. But what I'm doing is just pure education outreach throughout our communities to let people know what's going on, why this is going to help them, what we can do. Because, you know, remember December of 2012, the last crisis, the last government crisis that we all went through? And they were going to shut down the government then or something, I don't know. But anyway, they went through a lot of compromising, and they took all the money out of the Affordable Care Act that was there for outreach and marketing and, you know, getting the word out. So that's why a lot of people last spring and summer were sitting around going, I heard a word about this. I've been calling all over the state. I mean, literally, down in southern Kentucky, and I had people in health departments tell me, we haven't heard a word about it. Is this still happening? You know, because the word wasn't out. So a lot of organizations, us, insurance companies, Kentucky Voices for Health, Community or Foundation for Healthy Kentucky, lots and lots of organizations took it on themselves to get out there and do this outreach and education to let people know when, where, what. So that's why I'm here and what we've been doing. So I would be glad to come out to any organizations that you're involved with to do further outreach, and that's generally how it's been working. It's just kind of that ripple effect. So I've left my business cards over there, and this is a little sheet that we came up with. Very simple language, just to let people know deadlines, where to go, website, connect, why, maybe they could get help, all outlined there. A little insurance brochure about us, what we're doing here in Kentucky. And then I pulled out this out of our one of our benefit schedules. It's just talking about autism spectrum disorders that are on there and what you could expect as far as coverage on there with therapies and things like that. So I just put that over there. I mean, just not a lot of information for you, I realize, but just, you know, it is included in there. I wanted to let you know that. Well, I do have one last slide to show you, and this could be just a little information for you. There's the Kentucky Health Benefit Exchange. That's their 800 number that you can dial to get help. Actually, people can actually go through the application process right there on the phone. If they don't want to do it on a computer, or they're not feeling comfortable enough to do it, they can call, apply on the phone. This Kaiser Family Foundation, wonderful resource for all kinds of good information to know about. If you've never visited it, I highly recommend it. There's our website, Kentucky Health Co-op, and healthcare.gov. They're the one, they've been having the problems. Maybe don't go there right now. Give them a break. Anyway, so just a little bit more resources for you if you wanted to see about those. Does anybody else have any questions or?
I have a question.
Yes.
This is a little bit of a hypothetical, but what if you have insurance through your employer, but you find out it's a better deal if you go through the
Oh my gosh, I'm so glad you brought that
Yeah, or
up.
if you have terrible health insurance through your employer.
Or expensive.
Or could you
you
get,
pay money for it, but it covers almost nothing. That's
Well,
that kind of insurance.
this is what the deal is. You know, employers are supposed to be providing coverage to their employees, but it's supposed to be affordable coverage. So the rule says under the law that an employee may leave a group Because, and employers, they're really not gonna want employees to leave, because if they do, if they don't have like 80% of their employees covered, then they're gonna get in trouble. They're gonna face fines, okay? So it behooves them to provide decent, affordable coverage, but sometimes they don't. So the rule says that if someone is covered under a group, but the cost of the premium for them, that their employer makes them pay, is greater than 9.5% of their income, they get to leave the group and go shopping on the exchange for their own insurance.
So so if the
9.5.
premiums that the employee pays
Yeah.
is greater than 9.5% of their income.
Then they get to leave that group and go to the exchange. But my understanding is otherwise, they're really not allowed to, if they're given group insurance that doesn't meet that threshold, they're supposed to stay with their group. Yes?
Well, what if you're unemployed or receiving unemployment benefits?
And you don't have any insurance?
Yeah.
No COBRA, nothing like that, then you would be eligible.
Okay.
Oh,
Sure.
are you supposed to do COBRA first?
Well, you always have a choice to pick COBRA
But
or
that would
not have
probably be
COBRA.
more than
I was just like, Cobra's
9%.
expensive.
COBRA is very expensive,
Because the
so,
employer's not kicking in anything.
right, you're paying the full cost of what, it is. So instead of taking COBRA, you could go here to connect and see how it goes.
I have a question, because several years ago, like, what was that, like, in the mid-90s? We had health insurance reform here in the state, where they started having like basic plans so that people could compare plan to plan from company to company. So, do we still have that in this state, where you have the standardization of health insurance plans? You see what I'm saying?
Sure.
Does anybody know? I'm wondering because I hear you saying that about this, about this coverage that you would get through, you're talking about the different levels of plans and stuff.
Are you talking about more of an HMO?
No, I'm talking about like if you go and, there used to be like can somebody else help me?
Yeah, but a lot of them left the state, remember? After that came into being. And so what was left was just the kids' insurance, the CHIP, and Blue Cross Blue Shield and Anthem and those. So
Humana.
I think, Humana. So I think those are overridden now by
So I'm asking
Affordable Care Act.
Does the Affordable Care Act, I hear you saying like bronze and silver and whatever kinds of plans, and so I'm saying, do we have now standard plans that, like my husband's employer, is his health insurance supposed to adhere to a certain basic standard?
Well, there is coverage that everybody has to have now, like errands are free.
Yeah, you know what?
There's only a minimum standard.
I skipped,
Minimum standard.
Yeah.
I think she's saying, does everybody have to either have a gold, a silver, a
Available to
bronze,
you.
or?
well, that's
If you
how
pay for it.
insurance is
Exactly.
gonna be sold on the exchange. Now, what people are doing off the exchange is maybe not in that structure.
So that, the only ones this is governing, so to speak, are those that opt in to be a member of the exchange and offer policies through the exchange. Your company can exist without offering anything on here.
Yeah, people can still buy on or off the exchange.
And what many companies are doing is they're reducing, they're doing 2 or 3 things. One is they're reducing most employees to under 30 hours a week. So they don't have to provide any medical coverage at all. Like
I don't think most companies are.
That could be illegal though.
And,
They can get into an ERISA situation.
Well, for example, I just moved down here from Lafayette, Indiana, and I drove a school bus. And, they took most of the school bus drivers and moved them under 30 hours a week, as an example.
Yeah.
The other thing, so one of the big things they're arguing in Congress right now is that they're really forcing a lot of the people that work at McDonald's and stuff to under 30 hours a week. So, I mean, maybe not the coal miners and other, engineering.
I don't understand why they're already doing it. I know they're doing it because it happened to my daughter at her job, but I don't understand why they're doing it because the delays for a year. They don't have to comply with this until 2015, but they've already started this kind of action. So I hope that they can find a way to make it
And then
illegal.
the second thing they're doing is that they do offer health plans. They're really reducing, one of the big things they're doing is they're offering very minimal
Awful health insurance.
Well, I think a lot of that comes from it being so expensive for the employers to buy, that it's like, we can't afford this high escalation in costs, so we've just gotta cut somewhere, so they cut benefits to keep the cost of insurance down. Because it's just as expensive for them as it is for us.
Right, and what they can do, and they probably will do, is offer the lowest level plan that there is, which will be a lower premium, but higher out of pocket, like maybe $5,000 individual deductible. I don't know.
Well,
We're
like
gonna
where
see.
my husband works, they already have tiered. You know, there's like,
Sure.
you can buy the most expensive and then you just pay a $10
Right,
copay, and then there's something in the middle, and then he got the one where you pay a $30 copay.
right.
You know, he got like one of the cheaper ones.
But
There's
no
3 or
matter
4
what happens in that regard, what level of coverage you choose, and this is something I skipped over, if y'all remember, I skipped over and said I was gonna go back, and I forgot, well, here it is, because it's the essential health benefits. This is leveling the playing field for everyone, because this means that no matter if you have the bronze plan or you've got the platinum plan, everybody gets this included.
But how does that, a few years ago, some of the people in this room went and testified before the Kentucky legislature. And there's an autism insurance law that therapeutic services are supposed to be covered up to their dollar amounts, like $1,000 a month of services. Now, is this superseding that law? Because I noticed in your company, 20 hours per month without a dollar amount being specified, so $1,000 a month under that Kentucky law, which is still, I assume, on the books. How does that play out to, the 20 hours a month might be more than that 1,000, what if it's less? Are you all going, do you still have to adhere to that?
I really don't know,
statute?
I wasn't aware of that, I don't know.
It's still,
But that's
as far as I
something-
know, still on the books.
Still on the
statute.
Right, and it's,
That's something I can find out if that
Yes, first
supersedes.
Uh-huh.
That's a good question.
because I was wondering about, so that's kind of what I was asking, what you're saying, essential health benefits. But it goes along with what you were saying, the situation that we have. Yeah, technically I have this coverage, but we have a deductible that's so insanely high that I can't actually access it.
Right.
So it's like having no health insurance. And so that's why I was wondering about how to get away from the employer's plan, because it seems so awful, you know?
Well, and they might change it, you never know, they might change it to be more compliant with having an affordable coverage that's actually coverage, because that's part of it too. You know, all these, what they call the skinny insurance plans, so they're going away. I mean, people, you know, the plans that would pay if you fell down the steps and rolled across the street into
Get
a
run over by
ditch,
a
and then
bus.
it's gonna, oh, here's the money.
Get run over by the bus.
Yeah, I mean, just those type of policies, that's, a lot of this law wanted to do away with that, because people would have those and think, oh, I've got healthcare coverage. No, you don't. You know, you can't have that and go to the doctor or go get surgery or whatever. That's not healthcare coverage, that's just some kind of supplemental.
Like catastrophic
policy.
insurance, that's frankly what I told my husband that we have. I was like, this is not health insurance, this is catastrophic insurance.
Right. And some people will feel that that's what they want, because people, like those young invincibles I was talking about, the under 30 crowd, you know, a lot of them think, I never go to the doctor, I don't need health insurance. But they might be in a bad accident, or they might have to go to the hospital for an appendectomy, then they'll have that.
Like when you're on there, and is it gonna ask you things like, you know, have you ever been, you know, like your health record, are they gonna give you surcharges and all kinds of stuff on top of?
You mean like, have you had heart disease? Have you?
Yeah, or
are
have
you?
you,
Pre-existing.
No.
do you take
No more pre-existing.
antidepressants?
No,
or-
they just
No
ask
pre-existing.
basically if you're over or under 50 and.
What they're gonna rate on is how old you are, where you live, and if you smoke or not.
That's
That's
right,
it.
because, you know, that was always my problem, it's like, I would even try to find high deductibles.
Right.
And then they're still wanting like $700 to $800 because, you know, you're on an antidepressant, or you had a high cholesterol thing,
Right,
or,
that's a thing
you
in the
know, things
past.
like that,
Right.
but yet you haven't been, you know, in the hospital forever, that didn't really matter.
Those
you know?
rating factors are all gone,
Oh, that's
thank
right.
goodness, everybody
Thank
breathes, so.
God.
I know, don't have to
I
worry
mean,
about
they
it.
just use that to like up the premium.
But now, if I'm like a a guy, I don't have to file maternity.
It just comes with it.
Oh, okay.
So you
So I'm
never
not
know.
paying extra.
Just in case. No, but this is all standard.
But as a guy, you are still eligible for newborn care. Because the baby is yours too. And you're entitled to family medical leave to take care of a newborn baby or a newly adopted child. So don't knock it out and say that's not me. It's a part of you.
It just makes everything a little bit more equitable for everyone across the board. That's, because, for years, a lot of even employers have been providing coverage for their employees that did not include maternity. So that meant if an employee or a spouse turned out pregnant, they were out a lot of money because there wasn't coverage in their insurance. So that's why things like that have been made these essential benefits, is mandatory across the board.
I'm gonna listen, so I'm gonna apologize.
Oh, that's okay.
But what's really important for us is the habilitate, Irene just said that on our listserv, but the habilitation services, that's something that.
do you know
Will that cover the kids who are, like my daughter has a medical card through Medicaid because she's officially a disabled person. So she's already has Medicaid, so I saw that habilitation in this coverage, so does that mean that would apply to the people who have Medicaid now? That's what I'm wondering.
I think so, because you know how EPSTT just goes to 21, 22, and so, because historically what they were able to do was to say, yes, we have speech therapy, but you only get X amount of sessions per year, and with this, autism doesn't go away with, doesn't go away with speech therapy, and so they were just totally kicking out the whole concept of lifelong support that you would offer to an individual with habilitation, and I think that is probably for us and with our loved ones that are in the autism continuum is going to be really important, because that's going to be in every health insurance plan. And it's womb to tomb, it's once your child ages out of the services to EPSBC. That's pretty cool.
What is EPS?
Us in Medicaid thing, but
it's early periodic
screening,
testing, and diagnostic.
And if a doctor says this child needs this intervention or treatment to ameliorate the issues around whatever the medical condition is, then it's a federal, and the service is required to be provided. Even if Kentucky Medicaid says, oh, no, we don't do that. That's too bad. The feds say, no, this will be provided.
Well, that's something. I was wondering about the habilitation, because I know that right now with Medicaid in Kentucky and therapy, like related services, that like our case manager had said to us at one point, that the therapists have to be very careful about how they write their treatment note write-ups, that if it doesn't appear to indicate that the client is making progress, then Medicaid was using that as an excuse to get rid of people's therapy services. And so so that's because they would say there's no longer progress, therefore there's no longer rehabilitation occurring. And so if it's habilitative, then it's like, yeah, you need that because you keep forgetting that your left hand is out here and you need to work to bring it back in.
I have a question just for you guys. Is anyone getting EPDST services from Horn and Richardson?
Yes, we are.
Through Horn and Richardson?
Yes.
Through them, or they are
we are servicing treatment from therapists who work for Horn Richardson through the EPSDT program. Yes.
And they bill?
Yeah, they bill EPSDT. But we're only be able to receive, right now we're only be able to receive half-hour sessions, which I'm also hearing is no longer the case, or shouldn't be the case, or something. It's goes through nurses registry.
So you're getting it through nurses registry, but then you go through Horn and Richardson?
Horn and Richardson, yeah.
Okay.
Well, thank you so much for letting me be here tonight. I'm sure this will continue for more discussion with you all. You said you have a listserv, so hopefully this will get the ball rolling on that and open up some more avenues. Thank you so much.
Thanks.
Thank you.
Where do you have to go back to now?
Back to Louisville.
Oh, I'm sorry.
If anybody else has any observations to make.
I would just like to introduce myself.
Yes, hi.
I'm sorry I was late, I had to pick up my wife. My name is Phil Spotswood, and I have a 20-year-old